Thank you. Just a correction. I'm the coordinator, and we have a president who's maybe familiar with you. It's Professor Jan de Maasenier from the University of Kent. And I'm based in Utrecht. I'm pleased to be here as a speaker on behalf of the European Forum for Primary Care to speak about one of our main issues within our network. It's about interprofessional collaboration, interprofessional education. Just a few words about myself. You had some nurses already in speaking this morning. I understood, I met the president of the Nursing Association in Slovenia. She was just before lunch. I'm a nurse myself as well, from background. I worked a lot for Doctors Without Borders for a couple of years. Became more and more interested in public health issues, and now, I did my master's in public health, and since 8-9 years I'm coordinating this European Forum for Primary Care, which was established in 2005, and I just showed Theo the picture here, and he was there in, I believe it was 2004 even, when there was a first meeting in Brussels, bringing together some interested parties around the theme of primary care. So, as said, we are based in the Netherlands at the Nivelle Institute, which is a health systems research institute, mainly national, but also very active on the international level, and they do a lot of international comparative research on primary care issues. And then we have a board, as any network has, and it has its spread around Europe from a range of countries, and from a range of different levels, because I think that is very important. We try to involve as well the policy, as well as the scientific, as well as the practice level. And if we talk about the practice level, it is clearly multi-professional. We have the dietitians on board, we have the pharmacists, Balázs Hanko will talk later. That is something what makes us different from, as you all know, WONCA as the representative, the scientific representative of the GP profession. We are broader in that respect. We are paid by our members, and that is rather important because we also need to do our advocacy, so we stay out of any industrial sponsorships. Our members pay the network, the secretariat, and that's how we survive. 110 institutional members already all over Europe. Why we have established this forum? It's dissemination of expertise, knowledge on primary care systems. It's about the organization of primary care, not about the clinical aspects. We stay out of that. We try to support our members on implementation issues. Very important, I think, if we talk about what is happening in Central and Eastern Europe in the last decade, to show that there is support from elsewhere, and that you can count on partners in other countries. We try to base ourselves on some key principles. So there's the World Health Report 2008, primary health care now more than ever. And then certain aspects are important from now to the document. And you have the Tallinn Ministerial Conference in 2008 on health systems, health and wealth. So these are important documents where we try to emphasize the patient perspective as a starting point for service delivery, with some values which are important: accessibility, continuity of care, coordination of care, and comprehensiveness of services. And from out of those basic things, we try to advocate for integrated and community-oriented primary care, including interprofessional collaboration. But that's our main purpose why we exist. And in this 10 years time, we can be proud, almost 10 years time, that we can be proud that we have established certain certain roles, and we can knock on the doors of important persons in Europe at the WHO level. I will come back to that later. So this is the community-oriented primary care scheme. Well, I think you have seen it before. It's about identification of community health problems, then develop interventions, monitor the impact, and then you start, of course, with define and characterize the community, and you monitor then the impact of the interventions. And with all of this, you involve the community. We have some very good examples from Ontario, Canada, our colleagues in Canada, where they really have within the boards of the community health centers, they comprise of the citizens of living in that community. They define what are the real needs of the population over there. So these are just to start. I list a little bit of some latest developments at policy making level. What has happened in the last years, emphasizing what is important for primary care, GPs, and the interprofessional approach. So, if you look at the document issued by the European Commission, Investing in Health Key Messages, it gives clearly directions which are favoring primary care and the importance of the GP. And using financial incentives to encourage patients to register with a general practitioner, and using a referral system to define a cost-effective path of care from GP to outpatient specialist to hospital to emergency care. And they should use less resources to unnecessary care and emergency services. And they suggest measures in reducing this unnecessary use of specialist and hospital care and improving primary care healthcare services. Health 2020, reaching higher and broader. So it's about upstream causes of health problems. It's about investing in public health and primary care, etc. Expressed by Susanne Jacob, director of the WHO of the regional office in Europe. From out of our own position paper, we try to make a sort of a definition of interprofessional collaboration. So primary care is the central pillar of healthcare. The increasing complex health needs of the population and individual patients is changing in a changing society. Can only be met by promoting interprofessional collaboration within primary care teams. It's not a definition, it's just a way of saying what is the importance. So if you look at an interesting meeting last year, a bit more than 1 year ago in Oslo, on the economic crisis. It was the European Observatory, it's a WHO think tank, that they said accessibility of vulnerable groups is key, primary care is key, which is again a signal that we are being heard at EU and at WHO level. But there was another interesting statement of Professor Alameno, maybe some of you know him, and he said the redistribution of income and power of health professionals is key to create solutions for the future. And that is, of course, if you talk about interprofessional collaboration, a very interesting and challenging one, because there is an issue that's already at international level, that's on national level, but also if you look at local level. Just show you want to tell you some stories about projects in the Netherlands, for example, where they do a nice stakeholder analysis to address, for example, better diabetes care or mental health care. So they need different stakeholders within that community to take care of the population. But only by doing the stakeholder analysis, they miss something, and that's, in fact, the gain and losses analysis. Because some of these stakeholders, if you do such a project, will gain some income, even some power, and others will lose. And this kind of analysis are almost never made at the start of such a project, resulting in a situation at the end of the project that, well, or already in the middle of it, that the stakeholders are not very satisfied. And then in the end, the project is not continued because there has been not a real good redistribution of these income and power. Well, going on, more recently, there was the EU Summit on Chronic Diseases. So there were a few health ministers, Greece, Ireland, Wales, and they really started all with primary care, mentioning that this should be the investment. And we were there, Jan de Masseneer and myself, and we tried to bang on the door every time when primary care was needed to react. And in particularly when they talked about, you know, the EU is something what is, of course, it's about safety, it's about no more war, but it's also about economic development. And what you see is that they always try to combine these kind of things. So if you look now at chronic diseases, it's very much on how can we make the EU profiting also on the development and of technical devices and all kind of things which are nice to let the chronic disease patients buy for their treatment, but they forget in their enthusiasm, I think, to put it positively, that the biggest part of chronic diseases, the larger part, is of a low socio-economic status. And so we have said several times, well, you can try to invest in sophisticated technology, but you need also to invest in human resources, in the human aspects of the care. So there it is, the public consultation. It was already shared by the EQUIC members before starting this meeting. And I responded to that, well, we have been very much involved in already in getting our chairman, Jan de Masseneer, within the expert panel, and then even he became the chair of this expert panel. And so that is again a result that we banging on the door every time again, trying to get more access to EU decision makers makes sense, because now there is a real publication on public consultation on primary care definition, and with special emphasis on financing systems and referral systems. So it's an invitation to all of you, also the Slovenian delegates, to respond to this opinion before the 18th of May. Of course, the content, what you bring in, the response as you phrase it is important, but already the numbers are very important. If the European Commission receives hundreds of responses, it makes sense, because it will count. It will be on the table of EU Commissioner Tonio Borg, and he will see that there were so many responses. And that includes that of course, you need to be critical. I saw the Spanish response, which contains a lot of critical points, but don't forget express also that this is the glass is half full, and that there is already such a primary care public consultation that it is much welcomed, and that it is valid and very good for the health systems development in Europe. Tomorrow in my workshop I will try to elaborate a little bit more on this expert panel opinion. So, it gets a lot of attention, primary care, policymakers and researchers. It has an enormous potential. And we as primary care professionals need to make the case. And then I explicitly say, okay, not only GPs but also the other professions. And in order to achieve this, these different professionals should share their interest and strive together for a strong primary care movement. But can we make sense of multidisciplinary collaboration in primary care? That's coming out of a publication of some Dutch colleagues in 2011, where they state it's widely acknowledged that it is necessary, widespread multidisciplinary cooperation in primary care has proven problematic. Why is it so difficult? Well, I think because it's deeply rooted in the educational system, causing distrust, subsequently income and power inequalities. Just a recent recommendation for action from the Conference Board of Canada. They set 9 recommendations, and one was to mandate high-quality interprofessional education and training for all health professionals to support the development and mastering of core competencies of international collaboration. So that's underlining that it is necessary. What is it? Well, you can make a very small definition. Occasions when 2 or more professions learn from, with and about each other to improve collaboration and quality of care. In Australia they have been quite active on this topic, but even there you see that in reality it's marginalized, it's not getting off the ground really. Although when I presented this a year ago at the Bonka Prague conference, there was an Australian colleague which argued that it was better than it was evaluated by the audit report of the Health Workforce Australia. So then we have Julio Frank, who published this document, Education of Health Professionals for the 21st Century, and it's clearly stated, promotion of interprofessional and transprofessional education that breaks down professional silos will enhancing collaborative and non-hierarchical relationships in effective teams. So what is then the reason why the educational system fails to educate primary care professionals in a more collaborative way? I think there are 4 things which are very important. Working collaboratively is not something you can learn technically. You need to practice interprofessional collaboration from the first year onwards. You need to feel the added value of practicing together, and the most important, you have to find your peers, crossing professional boundaries during basic vocational training. Being able to work effectively as members of the clinical teams during studentship is seen as fundamental part of learning, as said from the Interprofessional Education Collaborative in Washington. Solutions should be found in new thinking within national, international professional associations and within educational institutions. There should become mechanisms, groups, which look for arrangements through which national and interprofessional education and learning can be developed. One of such a mechanism, international mechanism, is the Institute of Medicine, and they have a global forum on innovation in health professional education. And they aim to apply an ongoing multinational, multidisciplinary approach to explore promising innovations in health education. And that's a very interesting group of people where all these kind of examples come together. They had a very, very recent workshop last week on scaling up best practices in community-based health professional education. You can look for it and you can find a lot of interesting material on this website. So, a few examples of those that are mainly coming from the IOM, but there are even more. So the University of South Carolina, a student-run clinic within the basic curricula, with more than 200 students involved and 4 different disciplines. And then an example from India, where the interprofessional training model to bring together physicians, nursing and public health leaders together in the educational phase. The Stellenbosch University from South Africa, there are very nice things going on, partly on developing leadership skills, and then it's not playing the boss within the team, but it is about being able to stand for a certain new way of approaching healthcare. And so that should be fostered not only with GPs but also with the other professions. And then the other part is real interprofessional skills building, teamwork in primary healthcare settings. From Southampton, Portsmouth, also a very, very nice new learning programs established. And I think that's worthwhile to check. I know that also Nijmegen, of course, has its own, in the Netherlands, has its own developments with the Koplopers projects. So, and then there is again an example from the United States, from the Eastern Virginia Medical School, and that will be presented at our own conference in Barcelona. So I'm looking forward to it, where they also define a program for 200 students with 6 different professions. And then we are not the only one who's dealing with this subject. You have in Europe European Interprofessional Practice and Education Network, IPEN. They have been here meeting last year, as far as I know, in Ljubljana. Next year they will be in Nijmegen. They developed all kind of documents and interesting examples, and they have their European Charter where they work on new ways of pushing for it. By the way, this Nijmegen conference will be shortly before our own conference next year in Amsterdam. So we will try to combine certain things with the IPEN network. Well, this is our this year conference, just to end, in Barcelona 1, and it's the 1st and 2nd of September. And these are our references if you want to have more information on the European Forum for Primary Care. We are quite active. As we do a lot of advocacy, we are very active in the social media. We try to bang on every door, every day again, through Twitter, through LinkedIn, and it works. You get heard. They start to recognize you, and the words of primary care and the professional collaboration. The paradigm shifts from disease orientation to goal orientation, all these kind of themes they start to be resonating within EU level, and that's what we are aiming for. Thank you very much.